Varicose veins are enlarged, swollen, and twisting veins, often appearing blue or dark purple. They happen when faulty valves in the veins allow blood to flow in the wrong direction or to pool. So in this video, I'm going to share with you what varicose veins are, what causes them, 3 ways to treat them, and 5 ways to prevent them. So stay tuned till the end. Hi guys, you've seen Arsalan Media Pharmacist here on YouTube. This week's video is on varicose veins. If you haven't already, smash the like button below now, as I greatly appreciate it and it helps out the channel so much. Also, while you're at it, hit that subscribe button with the bell to stay up to date with new weekly videos. And without further ado, let's talk about varicose veins. Approximately 1 in 4 adults in the US is affected by varicose veins. They are large, swollen, and twisted veins that often appear and can be felt on the legs and the feet. They happen when the valves in the veins do not work properly, so the blood doesn't really flow effectively. You see, your veins bring blood back to your heart through a one-way valve and elastic walls. Over time, the valves weaken and the walls lose their elasticity. Blood starts to backflow and pools until it stretches out the veins for good. This typically happens in the calves or the inner legs, as these regions are more vulnerable. Because leg veins are the furthest from the heart, the blood has a longer way to travel and works upward against gravity under constant pressure of body weight. The blood ends up leaking back into the lower part of the vein rather than going toward the heart in one direction. And this is what causes the varicose veins. They typically aren't dangerous, and the common complication you might experience is the open wound or ulcer, which happens 3 to 6% of the time. You should have your doctor look at them if the open wounds do not heal within 2 weeks, or if there's any major swelling issues and redness and that doesn't go away, or bleeding. A deep vein thrombosis, or DVT, is a serious condition with blood clots occurring in the deep veins. This doesn't usually happen with varicose veins because varicose veins affect the veins close to the surface of the skin. However, with severe varicose veins, there is a small chance of developing blood clots in the deep veins, so please have your doctor look at them. It's important to distinguish between varicose veins and what you hear quite often referred to as spider veins. Spider veins are similar to varicose veins. The difference is that they're smaller and more superficial. While varicose veins are thick and blue, spider veins look stringy and reddish and can show up on the face, chest, or legs. Your doctor will want to look at your varicose veins to rule out any other underlying conditions. Tests such as ultrasounds or venograms help ensure that another disorder like a blood clot or a blockage isn't causing the pain and swelling in your legs. After your doctor has ruled this out, the following 3 treatments can help. Number 1. Improve your circulation. This includes getting enough exercise throughout the week to maintain good health, which is about 150 minutes of moderate aerobic activity or 75 minutes of vigorous aerobic activity a week, or a combination of moderate and vigorous activity. Exercise also helps to lower a person's blood pressure, which is another contributing factor to varicose veins. Other ways to improve your blood circulation is losing enough weight to maintain a healthy weight range that is suited for you. Massage, as this can also help to keep the blood moving through the veins. Just make sure not to press firmly against the veins. And lastly, keeping the legs elevated at the same height as the heart or above can help to actually improve circulation, as this reduces the pressure in the leg veins. Do this for 3 to 4 times a day for about 15 minutes at a time. Number 2, the use of compression stockings. A study from 2018 found that people who used knee-high compression stockings with a pressure of 18 to 21 millimeters of mercury for 1 week reported a reduction in the pain and aching associated with varicose veins. But if your varicose veins are mild, you can start with 8 to 15 milligrams of mercury, and the benefit to them is that elastic stockings squeeze the veins and prevent blood from pooling, and it can be very effective if they're worn every day. Number 3, medical procedures. The 4 major ones being sclerotherapy, which is the most common for varicose veins and spider veins, in which a salt or chemical solution is injected into the vein. They scar the lining of the vein and they no longer carry blood, and other veins end up taking them over. Thermal ablation, which uses lasers or radio frequency energy to either destroy the vein or shut down the vein. Then there's vein stripping, which removes the vein altogether. And then lastly, microphlebectomy, in which special tools are inserted through small cuts or incisions, which then remove the varicose veins altogether. Talk to your doctor to see what the most effective treatment plan or procedure will be for you, as they can actually take a look at your veins and decide from there. Now that we've covered treatment, let's look at 5 ways to preventing varicose veins. Number 1, reducing your salt intake. The 2015-2020 dietary guidelines for Americans recommend that Americans consume less than 2,300 milligrams of sodium per day as part of a healthy eating pattern. Salty or sodium-rich foods can cause the body to retain water, so cutting down on salty foods can minimize water retention and the appearance of enlarged veins. Number 2, wear non-restrictive clothing. Wearing tight-fitting clothes can restrict blood flow. Wearing loose-fitting clothes that do not restrict the blood supply to the lower body will help with circulation. Also, wearing flat shoes instead of high heels may actually help with varicose veins in the legs as well. Number 3, avoid crossing your legs while sitting. This increases the pressure on the veins and can actually make them appear larger. Number 4, I'm going to stress the importance of exercise again. Strong muscles help expedite pumping blood out of the legs back to the heart. And lastly, number 5, hormone treatments such as birth control pills may increase your risk of varicose veins. This is because female hormones tend to relax vein walls. So if this is an issue, look for alternative methods of birth control that could equally suffice. Over time, vein valves will naturally tend to get weaker, causing varicose veins to get worse. So you can't do much about your age, gender, or family history, but having a healthy diet, getting regular exercise, staying properly hydrated, and keeping your blood pressure healthy are all aspects within your control that can help you better manage varicose veins. So don't feel hopeless. I hope that this video was informative and helpful to you. I may not have covered all of your questions, so feel free to comment down below what you thought and let me know if you did enjoy this video. Thanks so much for staying tuned all the way to the end of the video, and as always, I'll see you on the next one.